2 weeks ago, we told you about Jonathan Stanley and his battle with long COVID.
The lingering effects of the virus have kept him from working with his nonprofit group like he used to. Now we're learning what we know and don't know about long COVID.
Doctors at Johns Hopkins Bloomberg School of Public Health are researching it. Sarah Hammond tells us more, new at 6.
For millions of Americans like Jonathan Stanley,
I still have a singing voice.
a negative COVID-19 test does not necessarily mean their battle with the virus is over. That's because they're dealing with long COVID. Recently, we told you about one man's battle.
And I went to the doctor and they said this is part of those long-term effects we talked about as a long hauler.
Since Stanley's second COVID-19 infection 9 months ago that put him in the hospital, he's still trying to heal. He's lost 135 pounds, his sense of taste and smell, and his voice. Even worse, his doctors also believe he developed throat cancer because of the coughing and the strain the virus put on his body.
They can't say this for quote unquote, like this is what happened. But this is a theory.
And Stanley is not alone on his long journey to recovery. Dr. Priya Dougal, a professor of epidemiology at Johns Hopkins Bloomberg School of Public Health, says globally, an estimated 1/3 of people who had COVID are now considered long haulers.
If we think this could even be 1%, it would affect 800,000 people, given that 80 million have had a COVID-19 infection in the United States.
The WHO defines long COVID as new or persistent symptoms 3 months after your initial infection that lasts for 2 months or more. And medical experts say based on what they know, it doesn't matter your age, race, sex, or how severe your infection was. Everyone is at risk.
No one gets a free pass.
Long COVID symptoms can range from mobility issues to congestive heart failure to mental disorders. Dougal says there is still so much we don't know about what constitutes as a symptom.
At the moment, there are no specific long COVID treatments, partially because we don't know the mechanism of long COVID.
Meaning doctors still don't know how the lasting effects of COVID attack the body. If you are dealing with long COVID, there is some good news. Johns Hopkins has started a COVID long study. The goal is to quantify how many people are dealing with this and what the risk factors are. For now, long COVID multidisciplinary clinics are opening across the country.
This will provide you with specialists that can address a multitude of symptoms and get you the best care available.
But as more people are infected with the virus and battle the ongoing symptoms, there are concerns about what that will mean for our healthcare system.
Overall, there is a general concern of who will be qualified and able to treat the burgeoning number of patients that we're going to have with long COVID.
In the meantime, Stanley is working with his doctors to fight through his long hauler symptoms.
This is just a season. It's going to pass. I'm going to get better.
Sarah Hammond, 13 News Now.
Dr. Dougal says they hope to get the initial results from their study on the effects on mobility by this summer. If you're struggling with symptoms, there are long COVID multidisciplinary clinics in Richmond, Lynchburg, and Norfolk at Sentara Heart Hospital. To hear more from Dr. Dougal, look for this story on the 13newsnow.com homepage.